All right. Welcome, everyone, to the 2022 edition of Community Conversations with your local legislators. So I am Representative Kate Donnally. We have Rep. Dan Noyes here, Senator Rich Westman. And what we're going to do today, I think most folks here, I have seen your faces in these before, so you sort of know how this all goes. But for the uninitiated, we are going to start with a brief intro from Dan and Rich, and then I have actually invited Ellen Hill, who also leads our local United Way chapter, to talk a little bit about the work that United Way has been up to, because they are so intimately connected with so many of the initiatives happening locally for our most vulnerable community members. And then, as usual, we're just going to open it up for chat, discussion, Q&A, see what's on your mind, and see if we can answer any questions for you. If you have questions, we'll sort of, we'll talk through it as we go through, but always feel free. Probably the best way to engage if you have an immediate question or something is to raise your little virtual Zoom hand, which you should be able to find down in your reactions area. If you're unmuted and it's causing some disruption, I may mute you. So just beware if you want to talk. Always sort of check your mute status. And all right, I think that's all the intro that probably we need. As I said, I'm Kate Donnally. I represent Belvedere, Johnson, Hyde Park, and Wolcott alongside Dan Noyes, and I will pass it over to Dan to introduce himself.
Good morning, Dan Noyes. Glad to see you all this morning. Thanks for coming.
And
go ahead, Rich.
I'm Rich Westman. I'm the senator from the county.
Thank you. And yeah, I will say one more prefacing thing, which I just say every time, and it hasn't really been necessary to say it. We've had some really great, I think, local community-based conversations in this venue about some challenging topics, and I think it's gone well. But just a reminder that the hope here is to create a safe and welcoming space for us to come together and have conversations about what's happening in our communities. Sometimes those issues are charged and challenging, and we have differing viewpoints on them. And so I would just hope that everyone here can maintain an open mind, can access their curiosity, can engage with respect and kindness towards each other as we work on some challenging issues. With that, Ellen, do you want to kick us off and just talk to us a little bit about yourself and what you guys are up to?
Sure. Thank you. Thank you. I'm glad to see you all here on a beautiful Saturday morning. And I just want to say thanks to Representative Donnally, Representative Noyes, and Senator Westman. I do have to kind of say it's funny to put your titles in there because I feel that you're Kate, Dan, and Rich. And that's what's beautiful about this county is there's such a closeness and a real community. So I feel like the three of you are friends, and it's just so neat to feel that and the connection to you all, the warmth and the genuine care and wisdom, and to be our voice in Montpelier is really great. So I'm just going to give a short overview of United Way of Lamoille County, and I appreciate the opportunity to do that. I've been co-executive director of United Way for about 15 months right now. It has been a very, very steep learning curve. I worked at Johnson State NVU for 30 years and had lots of connections in community, but it's different to come off of the hill and go into community and try to influence positive change through the nonprofits and in collaboration with the for-profit and public sector. So we've got so much going on, but I'll just give you a couple brief highlights of some of the programs we do and the initiatives we're involved with. We have a program called New Foundations in Morrisville, which is a transitional housing program. It's for single parents and children. I feel very successful. It's a 2-year program where people can come in. It's all women, and they stay there without having to pay a rent fee, and they get wraparound services with financial coaching, workforce readiness, pursuing their educational goals. And then the ultimate goal is for them to put money into savings to then move into secure and stable housing. It's been very successful, and we work a lot in collaboration with our community partners around housing and numerous other social service issues. We have an emergency assist fund funded by donors, local donors, and outside of the region, for people who need short-term emergency assistance to remain employed, remain in their housing. It might be they need a tank full of gas to get to work. It might mean they need steel-plated boots to go to work. It might mean they need a tank full of gas or oil. And those small amounts of money make a profound difference for the people who are accessing the emergency assist fund. We have our famous firewood project, which Dan Noyes has been instrumental in the startup of that. Richie's been a part of it as well. But we have an articulation with the state. This past year is with DCF and Emergency Fuel Assistance Program. And we purchased log length wood. I don't know if you've all seen the great wood lot in Morrisville, but we buck, split, and working with volunteers or people who are in need of home heating assistance to receive a cord of wood. So we do big work parties, volunteer parties. This past year on September 11th, we had 50 volunteers there for a day. Representative Noyes showed up with his truck and a trailer, went out and did deliveries. But it's truly a community building event. A lot of hard work, and we probably have about 25 more cords to process, and we're going to purchase another 20 cords in the very near future, or the equivalent of with log length. United Way is very proud of our resource page on our website. So uwlamoille.org, get help. And we have 24 areas where it's like Vermont 211 on hyperdrive, and it has resources local to Lamoille County. Everything from town assistance groups, education, workforce readiness, transportation, housing, substance misuse. And we're hearing from a lot of local nonprofits, human service organizations, that they're accessing that website a lot to help connect people to resources in our immediate community. That's dynamic. It's being updated probably almost daily, if not a couple times a week. And one of the initiatives I'm most proud of is our Working Communities Challenge. We received a $315,000 grant from the Federal Reserve Bank of Boston, with ultimately creating strong communities, a strong community and a healthy economy. And we're working on barriers for employment for our most vulnerable people. And we're looking at workforce readiness, broadband access, childcare, transportation, racial equity. And we hosted a summit in November with 100 people. 50 people were at Jenna's Promise, 50 people were virtual. And we identified our initiatives that we really want to focus on. We really heard the word hub. We really want to create a more strategic hub to connect people to resources and really do cross-sector work. And another issue that really came up, which I'm sure everybody's aware of, is housing. So we've also put on our plate housing to try to be big picture, identifying what's going on and where there may be some gaps, and how United Way can help pull people together and look at the really tough issue of housing. We do a lot more. I'll stop there, but I just have to say I'm honored and proud to be a part of United Way and to be a strong connection and community. And I'll reiterate, it's great to have such a strong connection with our local representatives. So again, thanks for letting me speak about United Way of Lamoille County.
Yeah, man. I mean, I think hopefully folks can sort of get a sense of why I find it helpful. Selfishly, I find it helpful to hear Ellen talk about everything we have going on, because I feel like I'm always learning about new initiatives that you guys have going on. And it, clearly you are sort of at talk about a hub, like you're at a point of intersection of so many different issues. And part of, I feel like your work is being aware of what the needs are of the most vulnerable in our community. And so always curious to hear what you guys have going on. And I feel like you're, sort of represent in my mind this like point of intersection of like, what are we doing on the state level? What's happening locally? And like, how do these things all come together to just support people in our community who need support? So thank you for that. So as we open things up for questions, if anyone has any for Ellen, and Ellen, if you have, of course, any for us in terms of all the many things that you guys are working on and how we can be helpful, raise your sad little Zoom hand and I will call you and we can talk about it. Okay, with that being said, I think I'm just gonna open it up unless, Dan and Rich, if you guys have something that you wanna toss in there, but I can also just open things up for question and answer. That work for you guys, or is there anything? Rich, Dan, do you have anything else you want to say before we?
I see we got a question, but I'd be glad to update on what's going on in my world at the State House. But let's start with Diana's question. Figure out.
Yeah. Hey, Diana, how's it going?
Hey there. Good. I just finished up breakfast, so I'm actually on my way into the same studio, I think, where Jessica is at River Arts. Speaking of hubs, that's just become such an important hub in our community. River Arts has been. Thinking back 20 years, I can also celebrate having been involved in the founding of that. I was one of the board people who got that going. But since then, my life has taken a big turn, and I was a small business owner in Johnson for a while. And so I got the perspective of that kind of work. And then I went back into EMS, which was something that I did in the 80s. And then went to the Vermont Tech Paramedicine program and became a paramedic and worked full-time as a paramedic in Morristown up until last year. I left that job in March to go hike the Appalachian Trail. And I did that until November. And so now I'm unaffiliated with Morristown. I'm not a small business owner anymore. I'm involved with River Arts just as a person who likes to do art, no longer on the board, which gives me freedom to speak my mind just as a separate individual, just my own person. And of all the things that I feel like are most important right now to address, it's that EMS issue. I know I've spoken to each of you in the past about it, and I feel like I raised alarms, beginning several years ago for the state of EMS in Vermont as being at a critical juncture, and it's only gotten worse since then. And like I said, I'm just my own self speaking here. I don't have the same perspective that people at the Department of Health have and people who are involved at administrative levels. I'm just talking as a practitioner. And there's just fewer and fewer of us, despite the Vermont Tech paramedic program, there's just not enough paramedics to go around. The pipeline for training new EMTs has basically dried up. Bennington Rescue has started an innovative and very successful program of internship and apprenticeship. So they bring in people who are interested in entering the field and giving them paid work in addition to training to get more people into the pipeline. But that's in Bennington. And things are just in kind of a desperate situation right now in healthcare across the board as more and more people are turning to traveling work. After I got done with my big hike, I've gotten every job I've applied to, and none of them are in Vermont. And I'm going to join the ranks of people who are jumping ship and leaving to work someplace where I get paid a reasonable wage. EMS in Vermont has relied for volunteers since its inception, and it's a feel-good model that is broken. We can no longer rely on volunteers to provide this life-saving treatment. People think that all they have to do is call 911 and someone highly trained will be there to save them. And just the fact that you can call 911 does not guarantee that anyone's going to be available to come. Agencies are providing enormous amounts of mutual aid to other agencies when they can't fill the time slots on their own. And so there's often a delay in treatment. And mostly every town is struggling with this. Every town, every ambulance agency is trying to figure out the answer to the problem. And the only solution is going to be one that comes at a statewide level. And you didn't ask me what I think the solution would be, but I think at the root, it's got to involve some kind of legislation mandating that municipalities accept the responsibility and are required to provide emergency medical services to their citizens. Because until they have that legislation mandating that that service needs to be required, what's going to happen is what's happening in so many towns where they're just saying, this isn't something that we can afford to do. We don't have the volunteers to do it. And so we're not going to do it. And what ends up happening is the few agencies that do remain have to then cover that town in addition to their own. Of course, there's a business opportunity there for the agencies that are, even though they might be nonprofits, they're able to run more as a business than a volunteer thing. And a town can contract with them to provide coverage. And that's what we have in Johnson. We contract with them and they do an amazing, amazing job of covering a vast area, of Belvedere, Waterville, Johnson, Hyde Park. And if they don't have the personnel in Johnson, which they often don't these days, they are really good at backfilling from Newport and they'll send people down. But once again, there's a delay there. And there's no regional coordination. Newport Ambulance and Northern EMS have good coordination within their ranks, but there's no interface between them and their partners that, back them up with mutual aid. And there's just not enough money to them. Towns like Morrisville are going to be faced with a 36% increase in their budget for EMS this year. 36%. And that's to hire one more full-time person, basically. So there's got to be some state action. There's got to be some regional coordination. Regional ambulance down in Rutland has a nice regional model. But I am so hopeless that the situation is fixable at this point. I think it's really going to get even worse before it gets any better because it's just so badly broken. And
Thank you.
Thank you for letting me go on and on and on. And
thank you for sharing your thoughts.
Yeah.
So can I?
Dan and Rich, go ahead. I was going to ask if you had a response.
So, there's one bright point that a young man that I've been working with on the Office of the Child Advocate, Nate Farnham, who is in the Wolcott Fire Department, passed his first part of his EMS test and, is really psyched about getting into this. So there is some bright spots and, but there also is a huge workforce shortage. And if you look at nursing homes, personal care attendants, it's not good. Yesterday in committee, we were talking about the underutilization at nursing homes to the point where, people cannot be discharged from the hospital to a residential care facility or nursing home if they don't have the staff working there. So there's people in the hospital that are needing that nursing home level of care, but they can't go there because they don't have the staff to take on new patients. And so that's turned up to, I'm sure Rich can do the numbers, he's on appropriations, but I believe it was around like 2.7 million of underutilization just in nursing homes, we've talked this week. We had in the Older Vermonters Caucus, we had, which I run with Rep. Wood from Waterbury, we had a good discussion on engaging older Vermonters back into the workforce and what do we need to do around kind of like a benefits cliff, if you will. But, maybe there are opportunities, maybe people that have decided to leave the workforce might come back in around nonprofits and EMS and depending on nurses. I mean, you can go through, the list is a long one. And I'll be presenting some of that to the Commerce next week, Commerce Committee, with Rep Wood. So yeah, I hear you. And it's definitely, it's definitely something that we need to deal with. And it's important that all of our emergency response, whether it's sheriffs or fire departments and EMS, are, supported. But yeah, thank you.
Do you see the chance of any kind of legislation that would require municipalities to provide EMS?
So I believe that would be in government ops, and I'm not sure if anyone's put a bill in this session to bring that discussion up. I know the Government Operations Committee is working on redistricting, pensions. They have a lot on their plate. I'm not sure what. Nothing I have seen, but our bill deadline is back in first of January. So I'm not sure. I could take a look and see if there's anything on that in that committee and check in with Sarah Copenhagen, who's the chair. But I'll be glad I could get back to you on that, but I don't know.
So first thing I'd say is thank you, because you highlight something vital for all the community. What I would say to you is there's an awareness in the legislature, in the committees that I'm on and have worked around, that the problem exists. With COVID, it's exacerbated the problem, particularly in nursing across the state. We have, before COVID started, we have 25,000 licensed nurses in the state. We have, we're short 9,000 nurses. And the problem is we don't have the teaching staff to train them to get people to that place. So there's been a lot of concentration around that, because nurses helps home health, it helps nursing homes, it helps hospitals in it. And I might say to you that in the nursing area, a year ago, we were, the hospitals in Vermont, the 13 hospitals, were paying $70 million to traveling nurses, and that number's just skyrocketed. So those are the things that really, I think, that have all been exacerbated by COVID, have kind of, you can only concentrate in a big way to put your finger in so many holes in the dike. But there's an awareness, and I think the big thing is, how do we increase the pipeline to get more people to go into EMS? I think to increase the pipeline, there has to be a statewide effort to do that. And it's particularly around that training piece and getting people into the business. And that has to be a function of the state. I would be very interested in who in Bennington can talk about what they're doing, because if we have an example of something that's working, is there a way for us to replicate that in more places in the state to build that pipeline system to get there? I think to mandate on the communities right now that you're going to offer this service in this environment, we would have, the League of Cities and Towns would be all over us. If there was enough people in the pipeline, so we had enough people coming out to work to make sure everything was covered, and it was better times, that certainly might be a solution to part of this. But the most important thing for me right now is, how do I increase that pipeline of more people working? And the state has to have a role in that.
Most definitely. I'm so glad to hear you say that. And you know who has set a great model for that too is the our brothers in the fire service, because we have a statewide fire academy.
Yep.
our brothers and sisters in the law enforcement. There's a statewide police academy. There is no statewide EMS academy.
Well, that might be a really good place to start. And because what you're going to have to do is train people in nursing. Part of the biggest problem to get people through the nursing pipeline is the clinical training. And if you had an academy with people that were existing doing the EMS work, that's where your clinical work would come from, and build that connection to build around a training process. So, I would love to work with you to put together an idea of what a EMS training academy would look like.
Mhm. Well, the good news is that the State Department of Health training coordinator that works with EMS, it was a position that went unfilled for years. And that position has now been refilled by somebody who actually lives in Northern Vermont. And she's doing a fantastic job of beefing up a system, but it still has that weak link of the instructors.
Yeah.
The health Department of Health is spread so thin that they have one paid coordinator, and they're beefing up the pipeline with volunteers. And so these people who are already asked to give so much to their communities are now being expected to do additional training and have additional qualifications as these highly trained training people. As somebody who's been involved with EMS education for over a decade, I resigned as a trainer because I was not interested in taking on these additional responsibilities as a volunteer, because even though I was paid a small wage to work as a full-time paramedic, doing education as a volunteer was not sustainable.
So the new
So I'm just
person,
sorry, Senator
Sorry.
Westman, can I just jump in for a quick second? I just want to make sure that we make space for other folks in case there's other questions as well. This is such an important issue. And what I'm hearing is, I think we are all unified in an awareness that this is a massive, massive issue. And I so appreciate you being here and being aware that we have someone who has this expertise in our community. And I think what would be good, it sounds like Senator Westman's on board and I know I'm on board, is can I loop us together after the meeting and maybe we can find a time to connect and start thinking more strategically about how we could sort of move some ideas forward?
I would appreciate that so much, because I don't want to hijack this call as a one topic discussion. But I do have an appointment in at River Arts at 10. So that's why I'm so grateful that I was able to get my 2 cents worth in and have some exchange back and forth. But the idea of further conversation appeals to me a lot.
so
Cool.
it's a really good time to reach out. Why don't you email us? And it's a really good time because with this ARPA money coming in, I think the idea of a training academy for EMS is something that money might be really good to because it's a vital need.
Mm-hmm. Yeah, great.
Thank you so much, Dana.
Thank you.
Yeah, is there any other questions? Is it Liana? Am I saying that correct?
Perfect.
How's it going?
Well, thanks. Yeah, so I am a music therapist in the state, board certified, master's level, and thank you so much for your meetings, because I was actually just wanting to reach out about a bill that the Music Therapy Task Force in the state has put to legislature. It's HB 575, hoping for music and art therapy licensure in the state, which for those of us who work as allied health professionals would be a huge help for kind of expanding who has access to the creative arts therapy services that we provide. I'm not sure if you're familiar with music therapy specifically, but it's unique in the fact that it's a creative, strengths-based approach that is nonverbal. So it opens up helping folks who are struggling emotionally, socially, physically, mentally to be able to access it, even if they don't have words or don't want to use words with a practitioner. And so at the moment, for example, there's a few places in Vermont that have money for arts therapists, including the pediatric palliative care services, home health, which I work at, psychiatric acute mental health and substance misuse services, and educational settings. So working with children's individualized education plans. However, for example, a particular passion of mine is working with older adults with memory loss, dementia care, and as you've been talking about, the nursing shortage. There's also seemingly this barrier of being able to work with that population as a music therapist, which I've done in the past and seems to be a wonderful way to continue communication and mental health for folks. And so licensure would be an amazing way to be able to potentially expand where music therapists, art therapists can work. So I just wanted to plug that to you. I hope that's okay to do that here. And I'm so happy to talk more about what I do and how licensure would help all of us in the state. But we also just have a kind of write-up brochure talking more about music and art therapy in the state. And so if it's okay, maybe I could email that to you as a follow-up. And you'll be introduced to it in the legislature as well. So thanks.
Yeah, that would be great. I really appreciate you being here and the work that you do. As I feel like a broken record, but I'm a therapist myself and definitely aware of feeling like a broken record in terms of identifying. I feel like I'm always like, I'm Kate Donnally and I'm a therapist. I'm Kate Donnally and I'm a therapist. So I apologize if there's repetition in that, but it's a big part of my identity and how I experience the world in this work, and talk about an area that is in desperate need right now of people. And so, you know, there's always a million issues that can create obstacles, but just on the surface, definitely interested in trying to figure out how to remove any obstacles at all to that kind of thing. Yeah, Dan, go ahead.
I just wanted to talk to you about the process of what probably needs to happen since the bill's been put in. What you want to have happen is you want the chair of government ops to write a letter to the Office of Professional Regulation to ask for a sunrise report on it. And then they look at what other states are doing and make recommendations on licensure to the Government Operations Committee. It will take time.
So that's actually already happened.
Oh, it has.
Yes.
Fantastic.
Yes, because
okay.
The process started with music therapists pushing just for music therapy licensure. And then the feedback was, you know, there's too few of you in the state. I believe now there's 18 of us. So that is when art therapists and music therapists came together and said, look, there's a lot more of us. Together, this could be kind of more financially viable for the state working together. And so it's soon to be assigned to committee and then introduced by the primary sponsor, who is represented.
It's in committee. Carol Odie introduced it into government ops. Yeah, I mean, I would like to, I can reach out to Carol, or if you have a copy of that, it'd be good to look at it. And, you know, I have no idea. Another bill in government ops. Oh man, I'm glad I'm not on that committee. They have a lot going on. But yeah, you know, I think that's kind of the first step to licensure is really, did they give it, did they say it was something that should happen in that sunrise report? Do you know?
So I'm not on the task force myself, so I don't want to give a kind of false affirmative. It seems that they were saying, yes, come back to us, but you need to adjust some things, mainly just be music therapists. So there is a primary sponsor who is Representative Carrie Dolan.
Carrie Dolan, sorry. I saw Carol Odie on the list as well. Okay. Yep.
Yeah. And then a vote. So not being part of the task force, I probably can't tell you the nitty gritties of it, but it seems what I've been told is, you know, as a music therapist, just let your legislators know that this is going to be coming up for a vote. And so they know what it is and can make an informed decision on their vote.
Great. Yeah. And I can check in with and find out if that's something that committee is going to take up this session.
Okay.
I didn't even look to when the bill went in, but anyways, glad to connect on that. And I'll talk to my connection on there, Representative Gannon. I talk to quite often. So
Thanks.
he's the vice chair.
Can you just remind me of that committee that you just said?
Government ops, government operations.
Okay.
It's across the hall from human services where I spend all day.
Well, thank you. Sounds like we'll be in touch and follow up about that. Anyone else have any questions for folks who've just joined? This is just sort of open Q&A time. So if you have anything on your mind, it can also be comments. Feel free to comment. Yeah, go ahead, Anne.
I'm relatively new to the state, so this may be something you've talked about endlessly, but both in terms of veterinary services and regular human medical services, one of the things that has frustrated me is having to go to Burlington in emergencies and after hours, and being very uncomfortable driving there even in the day, let alone in the middle of the night, which is when these things usually happen. So I just wanted to put a plug in for as much work as possible on dispersing the emergency medical services. And I think that Diana already alluded to the fact that that's difficult because of the lack of personnel. But just wanted to bolster that request. And then secondly, I wanted to ask if people heard on VPR, and I can't even tell you what day it was, and it may have been streamed from NPR, I don't know, but they had an interview with medical service professionals in the UK and how they're working with an older model, actually, of doctors going and nurses going out to homes first to assess things, getting there quickly because they're close. And then involving the medical services if necessary, so that those things don't get tied up unnecessarily. And I thought it was kind of an interesting conversation. Maybe we could look at that as something helpful to us.
Thank you, Anne. Yeah, definitely sounds like a continuation on a theme. And I'm writing that down about the like personally welcome any kind of creative solutions to this issue that we're going to be looking at as a state for the next few years, I think. Dan and Rich, any other thoughts or comments about that?
I know that for children, we worked with the parent-child centers in the past to have a nurse go out with case managers from parent-child centers for new moms in our community, and they were seeing some good response on that, where kind of wellness checks on the baby and on the mom, and I know that's been pretty successful, and it's one of those programs that actually has been rolled out around the state with the different parent-child centers. What was it called, Rich? Do you remember the name of that program? It had an acronym. I can't remember it. Anyways,
I wish you hadn't asked me at it, but the lead program in the state that the model that we pushed out statewide came out of Lamoille County and came out of the family, and it's a wraparound services type program that I think was started in like New Zealand, and in following that model, but it involves those home visits. The problem in all of healthcare right now is the shortage of personnel, and and the system is being cannibalized from within with traveling nurses and stuff. I am just about to leave the Copley board for 10 years. And we have one member of the board at Copley. She is the director of a nurses training program at one of the SUNYs. I think it's SUNY Potsdam, but I might be wrong in that. And they're losing teachers because they can make $50,000 a year more being a traveling nurse. But every time you take somebody away from teaching, you take away, you shrink the pipeline, so there's less people coming behind. It's just a disaster what's happening in that. You know, the American Nurses Association talks about that last year, 80,000 people across the country applied to go to nursing school, and were eligible and had the grades to go and couldn't get in because the pipeline is so constricted. And so you're standing back, and a lot of the, and I'm sorry to concentrate on nurses, but a lot of those nurses, there, you start as an LNA, you go to an RN, you you become a licensed practical nurse, and you become the people that would be the very people that should be going out to people's homes to help them fill in the gaps and move that, because it's a profession where there's ability to move up.
And I also serve on the Copley board, and I can tell you that traveling nurses are well over $100 an hour, and we have to have them. I mean, you can't have a emergency room without nurse support. So yeah, it's and then I also hear of nurses who join travelers and go right back to the same hospital where they're working at for substantially more money, just because there's such a shortage. And yeah, don't have any answers on that one for sure, but it's something we're going to be dealing with for a while.
And we're dealing all the time now with telemedicine and encouraging more telemedicine, you know, on a screen like that. You know, as a stopgap, I think that's great, but there's nothing like somebody real that has some professional skills. And this may be because I'm old, but I don't think we communicate just with the mouth. I think body, you look at the way you move, and see, I'm using my hands right now. But you know, it's way better to have somebody sitting next to somebody.
So I'm realizing I went in sort of reverse order. I didn't really give us a chance in the beginning of this meeting to talk a little bit about what each of us is working on in our various committees and whatnot. And so I don't know if, I think personally I tend to like to prioritize questions and whatnot, but just naming that, you know, certainly Richard, Dan, if there's things you want to make sure that you talk about that you're working on, like, please let me know. I do see that Ellen's hand is up. So Ellen.
Thanks. Just not a comment, just a quick question. Knowing that so much money is being poured into the state with ARPA funds, and I think the solutions to our issues, clearly with Diana's conversation and others, we know solutions, creative solutions about how we use our local assets to create the changes we're seeking. How do we be proactive to try to pursue these funds where it's not competitive? And what's the process to the monies coming into the state, and then specifically to Lamoille County?
Senator Westman, are you able to start us off with that?
Well, I would say the first place that, you know, the first crack at any proposals to spend money usually comes out of the administration itself. And, you know, the issue of the nursing shortage, working with the state colleges, working with the health department, and is the first place to go is the administration. Because quite frankly, if we have the idea for an EMS training academy, the health department will have to be on board. If they come in and say this is a bad idea, that shuts right down any any work that we might do at the local level. So what I would say to you, Ellen, is if you have ideas, the first thing that we should do is sit down, and I'll use it as an example, Jenna's Promise. Jenna's Promise is in the budget for the state this year with $350,000 and over a 3-year period to help get their program started. But they work directly with Monica Hutt, who was the commissioner of Dale, and now is kind of the central person to in recovery and addiction. And they work very closely with them to get their program funded on a pilot basis to do that. Now it's in the governor's budget. I don't think there's any way that, you know, people like Kate, Dan, and I will be supportive, and people will ask us, but it's a lot easier lift.
Thank you. I appreciate it.
Thanks. Were there any other thoughts or questions that folks are eager to share or ask? While folks are thinking about that, maybe we can just sort of go around and talk a little bit about some of what we're working on. And as we're doing that, raise your hand if you have anything.
Kate, why don't you start?
Anything that comes up. Okay, sure. So I serve on the Judiciary Committee. Sorry, I was distracted. There's like someone in the waiting room, but it's just a phone number, and it's like not a Vermont phone number, and it's like getting thrown off by it. Okay. So I serve on the Judiciary Committee, and this year we've been working on a variety of things. I've read about it a little bit in the paper and a column that I've written, but essentially I feel like what sort of set the tone for the 2022 session for the judiciary was a presentation by the Council of State Governments. We've been working closely with them. This is initiatives that long predate my short time in the State House. I think the Judiciary Committee has been looking for a long time at areas that we have been struggling in our criminal legal system and law enforcement, and trying to really get clear about what exactly is the reality in our state. What are the sort of like high impact points where we're struggling, and how do we build good policy to address those things? And so Council of State Governments has been working closely on that. And we sort of kicked off our session by a presentation from them outlining the results of what is like a historically sort of exhaustive research effort at looking at our criminal legal system. And what they found, specifically in terms of racial disparities, was pretty alarming. And I would say just sort of echoes what, you know, racial justice and criminal justice advocates have been saying for a long time, which is that we have vast racial disparities in our criminal legal system and law enforcement. And so they offered recommendations to the Judiciary Committee on areas, policy areas we can work on, and sort of slate of bills that we're working on right now really are not, they address a variety of things within the judicial system, but they are sort of, all of them are sort of being seen through this lens. So a lot of it involves looking at reclassification of certain criminal offenses, exploring decriminalization, specifically around drug offenses, which is an area that has shown to have some of the highest rates of disparities. So there's a variety. We're in the process, a few years into the process of creating a division that would specifically look at gathering data related to racial disparities in our criminal legal system. data is a big theme. And so we're trying to figure out how to support efforts to gather as much data as possible so we can build good policy. So I'm going to pause there. And Bill, I see that your hand popped up. So I don't know if you had a question.
Actually, I was wanting to get back in regards to the lack of, I guess, medical care in the area. Based on what Ann was saying, I know my experience was 2 years ago, I had pretty sure it was COVID, found out with pneumonia. I went to the urgent care facility in Waterbury run by UVM. They did great. Unfortunately, they're no longer there. It shut down. But I heard through the grapevine that Mr. Tatro may be helping to establish a clinic or urgent care facility at the subway building in Johnson. Is that
Yes.
something? Okay.
Yes. Yeah. I know that he's just starting to. Jenna's Promise just starting to roll that out. I believe they are looking at putting a primary care physician in that building in Johnson. I've actually met with both of the nurse practitioner and her, and so I think you'll probably see that happen coming up here. So I think that's an important thing. We definitely need primary care. There's such a shortage of primary care doctors in this state. It's another, I mean, just like everywhere you look. So yeah,
I'll be interested.
Hopefully we can, that will.
I'd be interested in getting involved with that if someone can get me introduced to Mr. Tatro or whatever.
Sure, glad to.
Whatever I can do, financially or whatever, I'd like to be involved.
It's been a nightmare in Johnson since Paul Rogers closed down his practice.
Mm-hmm.
Mhm.
And having a community that size with no one there, and particularly a community that financially has some issues, it's a nightmare. And the problem is it's so hard to get primary care doctors. It's another area. The estimates are that statewide we're short 70 primary care doctors, and that's with each primary care doctor having 1,500 patients within that they work with. Well, that's roughly 1 out of every 6 people in the have a doctor. So when you look around at you, 5 out of 6 have a doctor, and a lot of our primary care doctors are older, and so we have to find a way to build that in. And I applaud what Greg and Don are working on, and trying to bring a licensed practical nurse into Johnson to help the community bridge the gaps of these shortfalls.
What do you think the barriers are to increasing the supply of doctors and nurses in the area?
So around general practitioners, it's because they don't pay like orthopedic surgeons and so if you're going to look into going into being a doctor, you might not look at being a general practitioner because you can get a lot more money in other niche pieces of medicine. So I think that's where it is. I mean, you even look, we have 3 gerontologists in the whole state, and we're one of the oldest states.
I think that's partly true, but and I could get into trouble with this, but I've been down this road before. When the university graduates 100 doctors, 115 or something doctors a year, and only 6 of them are primary care doctors, one would ask, if that's where the biggest shortfalls are, why doesn't the places like the university gear up to produce more primary care doctors? And quite frankly, I think there's a lot of sentiment in the community that we would underwrite a lot of their education. We send a quarter of the whole state appropriation to the university, goes directly to the medical school. But if you bring up the idea of them increasing that pipeline, they'll give you 1,000 reasons why they can't do that. And I just find that piece of it frustrating.
If the funding is rather finite, the doctors, maybe they net $15 after they spend 20 minutes on the computer documenting the visit with a Medicaid patient or a Medicare patient. There's got to be another way to try to make the net return to this doctor a little bit better, like maybe enticing them to come with some kind of a tax exemption, because the townships do that with companies. They give them tax abatements or whatever. Why couldn't they do that with the doctor?
Mhm.
It's kind of like a recruiting thing. You gotta find
Totally
a way to
agree.
bring them in.
Totally agree.
But when you talk about
All right.
giving somebody tax exemptions, all of a sudden the people down in Montpelier get all upset.
Well, there's always the question of who, right? It's not so much if it's a good creative policy solution, but you do it for one. Who do you do it for, right? Who gets the exemption? Is it retired military folks? Is it folks with Social Security? Is it doctors? Is it, all sorts. So I just want to name that it's 9:58, and I want to be respectful of folks' time. So thank you all very much for being here. If you come back next month, maybe you can hear what Dan and Rich have going on in their committees. Sorry, guys, I didn't really give you a chance to talk about those things. We will start with that next time. And feel free to be in touch via any avenue if you have questions for us or anything else. And Dan and Rich, again, not to put you on the spot, I don't know if you want to say your goodbyes.
Thank you.
I just want people to know I'm always available. You can reach out to me by phone, email, anyway, social media. Please, if you have questions or comments or have any questions about what's going on at the State House, I'd be glad to answer it. Just want to make sure people know that.
Absolutely.
that's the
Thank you,
same for
guys.
all